Hi there, I'm Shawna Robins, founder and CEO of Third Spark, and today I am doing an Authority Magazine interview on sleep, my favorite topic to discuss, with Dr. Michael Breus, who is a double board certified clinical psychologist and a sleep specialist. He has written three Amazon bestsellers teaching readers how to get great sleep, how to lose weight through sleep, and how to use hormonal timing to live their best lives. He was a sleep expert for WebMD for 14 years and is in the media regularly educating about sleep. Dr. Breus, thank you for joining me.
Thanks for having me. I'm super excited to be here. This is fun.
Yeah, it's great. So tell me, how did you become involved in sleep health?
Well, that is a story. I was getting a PhD in clinical psychology, and I was actually interested in sports psychology. So I wanted to teach athletes, how to throw harder and run faster and all this kind of stuff. And the best sports psychology residency program was at the University of Mississippi Medical Center in Jackson, Mississippi. Unfortunately for me, they only took the Harvards and the Princetons and the Yales of the world. I went to the University of Georgia, go Dogs, top 20 program, but wasn't Harvard. But they had a sleep track on the side that was extra, and it was fully funded. And so I had worked my way through graduate school in the Department of Electrophysiology. So I'm like the nerdy kid that likes to take shit apart and put it back together, and then all of a sudden it got fewer parts, but it works better. That's me. And so I did that for all the same machines that they use in the sleep lab. So I was like, I know what I'll do. I'm going to fool these guys, and I'm going to sell myself as a sleep guy, and then I'm just going to transfer as soon as I get there. Like, piece of cake, because if you're not letting me in through the front door, I'm coming in through the window because I want to be there. So I sell myself as a sleep guy. I get there, and day one, I raised my hand. They said, yes, Dr. Breus. I said, I really would like to transfer. They said, here's the deal. You're fully funded here, so you have to stay in sleep for the first 6 months. After that, you can do whatever you want. And so I said, how tough can this be? It's sleep, right? I mean, I do it every night. So I get in there, and by the third day, I absolutely fall in love with clinical sleep medicine. And I know I'm never going to change my career. I got to tell you something, Sean. I help people like this. It's unbelievable. When you change someone's sleep, you change their life. It's so dramatic. And for me, as a clinical psychologist, it can take weeks, months, even years to see any treatment gains from like depression, anxiety, anything like that. But with sleep, I mean, I can literally change somebody's life sometimes in 24 hours. So that became super duper appealing to me. And I was like, this seems like fun. I can't wait to do it. Let's go. So go back, defend my dissertation, get my first job. And during the job interview, the guy turns to me and says, hey, by the way, so here's where I was. Do you remember when if they just offered you $30,000, you could afford health insurance? Right? That's where I was in my life at that point, right? So first job, I can't wait. They offer me 60 grand. They offer me full benefits. They offer me vacation time. They said, but hey, Michael, there's one catch. At the end of the first year, we want you to take and pass the sleep medicine boards. And I said, Dr. DeMarini, remember I'm a PhD, not an MD. He said, it's a rogue board, and there's 1 year left of eligibility. You can be a PhD, an RN, or a DO, and you can take the boards. But after that, it's over. And I said, okay, but once again, I did not go to medical school. And he was like, you have 1 year for the contract. There's a reading list. Take and pass the boards or you're fired. So I went home, and you know what the first thing
Talk
I said?
about no pressure, right?
Right, exactly, right? And so the first thing I said to my girlfriend, now wife at the time, 60 grand. I was like, this is awesome. I can't wait. I figured it was a year contract. Like, who takes the medical boards without going to medical school? So I turned to my wife, girlfriend. I told her the whole deal. And she said, well, what are you going to do about that, boards thing? And I said, well, it'll just be a 1 year contract, and I'll just start looking for a job. And then she said the words that kind of sealed my fate. She said, I think you could do it. Hmm. And that was all it took. It was like challenge accepted. And it was a reading list of 14 books, all textbooks. So I taught myself neuroanatomy, neurochemistry, pediatrics, general medicine, and I took the sleep board. So my goal was really to understand insomnia from both the psychology and the biology. And I feel like I've accomplished that goal. And I feel like I have a very unique perspective. And that's kind of my bread and butter. That's what I like to talk about. That's what I like to work on most is insomnia and what I call disordered sleep, which is like, maybe you don't have a formal sleep disorder, but God, you wake up and you feel like crap. Like, how do we fix that? Those are the kind of the areas that I like to play ball in.
Okay, so give me an idea of a case study. Do you have an example of somebody that you've worked with
Absolutely.
recently? Yeah, that I'd love to hear, kind of how you've been able to help them repair their sleep so quickly, because it seems to be a
Yeah.
challenge for a lot of people to do that.
Yeah, it was interesting. So I'll tell you the story about a case where I failed, because I think that's always the ones where I learn the most. So I had a patient come in and it was awful. We tried cognitive behavioral therapy. We tried a million different medications through her physician. We tried some different types like alternate therapies like acupressure, acupuncture, things like that. We could not get anywhere with her. And when that happens, I bring people in and clearly I missed something, right? Like I had to have missed some factor that I'm not figuring out here. So about an hour, hour and a half into the interview, she turns to me. This is when I was practicing on the East Coast in Atlanta, Georgia. She said, if I just lived in California, everything would be fine. I'm like, what? She said, the time difference. She's like, they're 3 hours behind. She was like, I have to be at work at 9 and I'm exhausted. Like I fall asleep every day at work. Like I'm in trouble there. I'm pretty sure I'm going to get fired, and then I'm terrible in the morning. So my family gets upset because I'm not able to do the things that I want to do. And so it was very interesting. So I said, well, why don't you just change your schedule? And she said, well, my boss wouldn't like that. My family wouldn't like that. She says, I'm not even sure I'm going to get, keep my job. And I said, well, can I call your boss? She's like, sure. So I call her boss, and sure enough, she was going to get fired at the end of the week. And so I said, do me a favor. Can I have her come in for the next week, right? So don't fire her. Give me a week. She comes in well, she was actually supposed to be there by like 7. So I was like, have her coming in at 10 and have her leaving at I think it was like 7. And then we kind of cleared it with the house. The whole week I call on Friday, boss picks up the phone, first words out of his mouth, I have 3 more employees I want you to talk to.
Wow.
Right? So what had happened is she had an extreme chronotype, right? So that's the big thing that I'm kind of known for. And chronotype is a word that people might not have heard before, but conceptually you actually have. If you've ever been called an early bird or a night owl, those are chronotypes. It turns out they're genetic. You don't actually get to pick which one you want. And you go through all of them throughout your lifetime at different stages, right? So for example, when you're an itty bitty baby, you're an early bird. You go to bed early and you wake up early. Then you hit that toddler, middle school range, then you're kind of in the middle. Then you hit adolescence, right? What all teenagers want to do? Well, they're night owls, right? They want to stay up late and sleep late, right? And so then you hit about 20, 25, and you kind of stabilize into one chronotype, right? That seems to last you for about 30, maybe 35, 40 years. And then at around 60, you start going backwards. So like, you ever talk to grandma and grandpa and you say, hey, I want to come over for dinner. And they're like, yeah, dinner's at 4:30. Right? You're like, what's going on, right? That's because their timetable is kind of moving backwards. This is all a function of your core body temperature movement throughout your circadian cycle, which manipulates melatonin. So this is all biology based. This is not something, again, you can't choose to be an early bird or a night owl because your body is just all of a sudden, heating up to wake you up at, 4:30 in the morning. That makes you an early bird, whether you like it or not, type of thing. But it's interesting, once you understand which one of those chronotypes you're in, you actually have unlocked a very interesting future for yourself. Now, the only other thing I want to say about chronotypes is I discovered a 4th one. So we've always known about the early bird.
Would that be a menopausal woman? I'm curious.
So I'm going to tell you.
I'm 52, so I'm definitely moving chronotypes due to my body temperature changes.
So let me tell you something. I don't think you're so far off. So the chronotype that I discovered, I call them dolphins. So by the way, I renamed the whole system because I'm not a bird, I'm a mammal, right? So early birds are now lions because who wouldn't want to be the king or queen of the jungle, right? In the middle are bears. Night owls, I call them wolves. But there's a subgroup called dolphins, okay? And dolphins are people like this patient that I was talking about. They have this super erratic sleep schedule. For some reason, they don't usually know what it is. Remember, this is partially genetic, so the menopausal part might influence an already messed up set of genes, if you will, and that's my guess as to what happens, because most of the women that I treat that are in the ages of probably 45 to 65, because that's the demo that I think I hit the hardest, they're all having menopausal issues with sleep, and they all fall into this category of being a dolphin. So the characteristics of this person in particular, I've kind of zoomed in on some of the personality characteristics of it, is these are highly intelligent people usually, but they're just vibrating at like a higher intensity, right? They've got a little bit more anxiety on board. They're very much like an early bird in many different ways. Like they're highly productive, highly intelligent, usually trying to get there, but for some reason, their sleep is just completely wonky and kind of messed up. Now add menopause on top of that, and I think it's definitely a recipe for kind of disaster. So that's the areas that I find is so interesting about sleep. That's kind of the outside of the realm of sleep disorders, more inside the realm of like, wow, sleep can be pretty crazy for all kinds of different reasons.
Okay, well, tell me a little bit about your book. I know you have a new book out right now, and I'm curious how these chronotypes play into your new book.
So my new book is called Sleep, Drink, Breathe. Wellness is Too Complicated. And first of all, wellness is too complicated, right? Like it's kind of crazy. Like I was at the gym the other day and this woman was there and she was just looking around and I walked up to her, I'm like, are you okay? And she was like, I don't actually know what I'm supposed to do next. And I'm like, that feels like all of wellness to me these days. You know, it's like, am I buying a green drink? Am I getting in a sauna? And so what I wanted to do was distill wellness down into what I think are the most basic primary components that number one, everybody has to do every day anyway. And number two, these components, if you get them right in terms of like making them a little bit better and the way in which you do them, it will have effects across many different systems, right? I call it a domino, right? So it's kind of this idea of once you get this skill set down, it knocks over a bunch of others. Same here. And so I had to look and see like what's the most primary things that people do. So breathing, yeah, that seemed like a good one. I mean, the longest you can go without air, I think, is like 6.5, 7, 8 minutes. There is somebody who did a free dive where they actually 24 minutes. Can you believe that? 24 minutes. Like that's nuts. Hydration is a biggie. You can really go only about 2 days without water before things get really, really bad. 1 day it's not great. 2 days is really bad. Third day is you are in big trouble. And so a lot of people don't even really recognize that they're walking around in this state of dehydration. And then from a sleep perspective, I'd say some of the biggest things are, number one, understanding chronotypes and sleeping within that kind of chronotypical swim lane, if you will. Because here's what's cool that happens. Like if you read the book and you figure out, okay, this is my chronotype and these are kind of my guideposts for when I should sleep, what ends up happening is your sleep consolidates and raises in quality because your brain is sleeping when it wants to. Now, to be fair, if you're a night owl and you've got a job that wakes you, makes you get up at 6 o'clock in the morning, that's clearly going to be a challenge. The other thing is that sleep disorders don't just go away. So many people out there are like, oh, yeah, I've got crappy sleep because I've got 4 kids and I can barely afford my mortgage and blah, blah, blah. I'm calling bullshit on that. Like at the end of the day, if you're snoring and your bed partner hears you stop breathing in your sleep, get it checked and fixed. Okay. Like this is not going to just magically disappear. And so many people tell me this all the time, like, oh, I used mouth tape and I no longer have sleep apnea. Like you're an idiot. Okay. Like that's not how it works. Like you should be tested for sleep apnea before you use mouth tape. And then you could start to understand like the physiology of sort of what's going on there. So I think those are two big things from the sleep perspective that people, if you understand the concept of chronotypes and live within that kind of chronotypical lifestyle, it can be very advantageous. Believe it or not, you can figure out like the best time of day to have sex, eat a cheeseburger, even ask your boss for a raise. And then understanding what is a sleep disorder. And if you think you've got one, probably get it checked out.
All right. I love those tips for people. So I was going to ask you if you could kind of give me your top 5 tips on improving sleep. So I like that you just touched on a few of them. You have any other thoughts?
Absolutely. So what I've got a 5-step plan that I think everybody could take advantage of. It doesn't matter what your chronotype is, it'll work. Step number 1 is to choose one wake up time and have it 7 days a week. The biology on this is really interesting. It's called the melatonin phase response curve. But basically, if you wake up at a consistent time, that means that melatonin is produced at a consistent time at night on the regular, and that allows your body to get to sleep faster and better. So there's no sleeping in on weekends. Don't do it. It's a bad idea. I know you want to do it. Cut it out. Step number 2 is to stop caffeine by 2 p.m. This is important because caffeine has a half-life of between 6 and 8 hours. So most people don't realize that, but if you stop at 2, it's 10. That's kind of close to bedtime usually, and you've got at least 50% of it out of your system. If you can start back, once you get to 2, you can back it up to 12 and then to 10, and then maybe go caffeine-free if you can. Step number 3 is to stop alcohol 3 hours before bed. So here's the deal, is the more alcohol you drink and the closer to bedtime, the larger effect it has on your sleep. And I want to be clear about something. It destroys stage 3, 4 sleep. I mean, it just absolutely annihilates it. And by the way, that's where this thing called the glymphatic system comes in and scoops out all those bad proteins like beta amyloid and tau, which prevent Alzheimer's. So drinking before bed is a bad idea the older you get, just to be super duper clear about that. But if you can stop 3 hours before bed and limit yourself to 2 drinks, you're going to be in a much better place from a sleep perspective as well as a hydration perspective. And if you can, sprinkle in a glass of water in between each alcoholic beverage. Step number 4 is to exercise daily, but don't do it too close to bedtime. It increases core body temperature, and that makes it hard to sleep. So stop exercise 4 hours before bed. And step number 5, the last one, is to do in the morning what I call the 3:15s. So when you wake up, you want to take 15 deep breaths, you want to have 15 ounces of water, and you want to get 15 minutes of sunshine. The deep breaths are really to wake up your respiratory system and bring you present. The water is because sleep in and of itself is a dehydrative event. And the 15 minutes of sunshine, actually when sunlight hits your eye, it turns off the melatonin faucet in your brain, helps get rid of brain fog.
Ah, I love it. I love it. Thank you so much. I really appreciate you spending the time with me today and going over these things. And I think your book is going to be a huge asset for so many people. Sleep is such a big factor for people, especially now in the wintertime with the lack of sunlight. Everything that you touched on is 100% aligns with everything that I teach women to do. And so I really, really love that you've been able to put this all together in one place for them to find.
Well, thanks. And also I love the fact that you're such a sleep junkie. I mean, you're like a nerd junk. I mean, it's fantastic. It's great to have a conversation with somebody who really knows and understands sleep because we can get into the details and the audience can really benefit from that. So thank you for all your knowledge. It's great.
Yeah, wonderful. So where can people find your book? I'm assuming it's at all the
Yeah, no, you can find it on Amazon. You can find it at my website. My website is theSleepDoctor.com, and that's my handle on all of the Facebooks and Twitters and TikToks. I don't know if there's Instagram, all of those. I own The Sleep Doctor. So that's where you can find me. We throw out tips all the time. It's interesting. We've got a nice section on the website about menopause and sleep. So I highly recommend people check it out.
Great. All right. Thank you so much.
Thank you. Sweet dreams.